Yeah, hello everyone. So, our next topic for the e-content is reducing medication errors with a practical example on case of pyloric liver abscess. Firstly, we have to discuss what is a medication error. Medication error is an unintended failure in the drug treatment process that leads to a potential harm to the patient. What does it mean? That once a dose is missed or another medication leads to an error which can potentially cause harm to the patient. A failure in drug treatment process does not refer to the lack of efficacy of the drug, rather to the human or process mediated failures. Medication error can cause harm that could continue to escalate, costing the patient life and costing healthcare system billions of dollars each year. We have to discuss what are the types of the medication error. Here are type 1, a circumstance or a event which has no capacity to cause error. Type B, which has error but no harm. Same as is type C and same as type D. In type B, error occurred but did not reach the patient. In type C, error reached the patient but did not cause the harm. And in type D, error reached the patient, required monitoring to confirm harm and no need for intervention. As I've said, there is an error occurring but potential harm to the patient does not occur. Then comes the error is there and it also causes harm to the patient. First is your E, that is error may have caused temporary harm to the patient, required intervention. Then is type F, error may have contributed to resulted in temporary harm, required hospitalization. Then is type G, error may have resulted in permanent harm to the patient, and type H, error required intervention necessary to sustain life. Last type of error is known as type I, which is error may have contributed or resulted in patient death. It is the most harmful type of error that results in the life of patient. Next is clinical relevance and importance of reducing medication errors. Why should we reduce the medication errors? Clinical relevance refers to the practical or applied value or the importance of the effect on an intervention. The relevance also reveals whether or not the intervention makes a real or noticeable difference in everyday life to the client or to other of whom it's important. It is known that the error in medication administration are common and preventable, whether small, large, or even an insignificant error made by a healthcare professional can cause huge problems and compromise patient safety. Why the errors are important for client? The errors should be client focused and safety are the priority for the patient. Verifying the five rights for safety medication administration and protecting the client from error from early in the process or nurse misuses the mistake. What is the importance for healthcare professional? It eliminates the increase of error, accurate communication, pop-up alert for increased dosage, and stop medication error right at the bedside. Coming to the case, this case was a 53-year-old patient which was admitted to the OPD with the complaint of flask abdominal pain and fever with chill for past 3 days. On further history, she reported that she had been given 2 weeks of intermittent fever, chills, chest and abdominal pain, and there was abdomen tenderness. She was a tobacco chewer for past 10 years. At that time, she had been on azithromycin, tramadol, and acetaminophen for the presumptive diagnosis of viral infection. She was admitted in the IPD, which was in General Medicine Department. She had no sick contacts, and on the physical examination, her vitals, which included her blood pressure, were 130 by 75 mg, a heart rate of 80 beats per minute, and a respiratory rates of 20 beats per minute. So you can see that all the vitals of her were normal, but she was still presenting with fever, chills, and abdominal pain. After uh, the patient was alerted, there was no sign of respiratory distress. Further inspection evaluated that the abdomen was tended and there was sign of pallor and icterus. What is icterus? Icterus is a symptom of jaundice. The remainder of the patient physical examination was non-contributory. The investigations were performed on her, which included chest radiograph, which was a USG abdomen, CBC with ESR, RFT, LFT, and other viral markers. The impression of the USG abdomen or the sonography was hepatosplenomegaly with multiple hepatic abscess noted in liver parenchyma, largest volume of 135 cc. So what does it mean? It means there was presence of liver abscess or the pus formation occurred in her hepatic abscess. After the evaluation, after the reference from the surgery department, they advise for an HRCT chest and MRCP and metronidazole and diloxidine furoate. What does metronidazole do? Metronidazole is an antibiotic and diloxidine furoate is also an antibiotic but specifically used for liver abscess. The impression of MRCP were multiple hepatic abscess with few of them showing fluid filled in both lobes of the liver. The surgeon instructed a surgery which was known as percutaneous catheter drainage and aspiration. The procedure was performed for left lobe and the right lobe on the 9th and the 10th day respectively, with output of total 600 cc's of frank pus. The post-operative care were injection tazobactam, injection hepamers, and tablet ursodiol with a liver tonic. This was the case, but what was the error that occurred and how was the error rectified? On the 15th day, during the morning round visit, the physician noted the patient was not improving, even though the prescribed drug should have helped the patient to recover or improve the quality of life of the said patient. On this observation, the clinical pharmacist present in the ward decided to check the incident of the patient and noted that the tablet cloxidine furoate and injection hepamers were not given to the patient since the day 1 due to the unavailability of the stock. This was not notified to the clinician and everyone thought that the medicine was given to the patient, but in fact it was not since the medicine was not available with the patient. Then injection metronidazole, injection tazobactam, and injection vitamin K were administered irregularly. So what happened that injection tazobactam was given TDS, but it was someday given BD, someday given OD. So since the patient was not really educated, there was a chances of medication error. When checked, the patient was overstocked with the respective medicines. Upon further investigation, we found that the patient was taking tablet albendazole even though it wasn't prescribed. This error occurred due to the misinterpretation and reading of the prescribed drugs. So what would have happened that the clinician must have tried metronidazole, but since the metronidazole was not available, the nursing staff decided to give patient albendazole, and this resulted to the patient harm. So if we come to the pie chart once again, this is a type of error D in which the patient error reached the patient, but there was a monitoring required for further need of investigation. If the error was not rectified soon enough, then it could have resulted in harm to the patient and it may have caused a potential death to the patient. Here you can see we have taken the photographs of the hepatic abscess that was the patient. You can clearly see that there's a haziness in the abdomen area, and in the MRCP portion you can see there is a little bit of cloudiness in the left region while the right region is completely white portion. This clearly shows that the hepatic abscess was not treated due to the occurring of medication error. So why are we reading this medication error? We are reading this medication error because as a pharmacist, we should know about the potential medication error and the impact it has on a patient's life. And as a pharmacist, we have a moral responsibility to completely eradicate this error and prevent this error. Thank you.